Beginning January 1, 2026, the Virginia Conference will change how the conference-sponsored health benefits for active clergy are funded. Currently, the majority of the funding for the active clergy health benefits comes from an apportionment. In 2026, the apportionment will be replaced by a flat amount that will be directly billed to churches for each health plan eligible clergy person.
For many years, the Virginia Conference has been one of the only annual conferences, if not the only annual conference, to fund clergy health benefits through the apportionment system. Almost every other annual conference utilizes a direct bill arrangement like that which the Virginia Conference will adopt beginning in 2026. With a 2025 active clergy health apportionment of $9 million, this change will reduce the total apportionments by more than 35%. In addition to that reduction, the adoption of the healthcare plan direct bill funding methodology will de-emphasize the connectional aspect of our health plans. In the past, some churches did not fully pay their apportionments, resulting in the healthcare plan costs being subsidized by other churches who are paying their apportionments or through VAUMC's financial reserves.
As is the case with nearly all employer-sponsored health insurance programs, in the Virginia Conference Health Plan, the employer pays the majority of the plan costs. A smaller portion of the cost is paid by plan participants through their monthly contributions. In our case, the health plan apportionment has represented the employer's contribution to the cost of coverage. VAUMC uses national employer survey data to structure the funding of the conference-sponsored health plans in a way that matches the average U.S. employer-sponsored plan, with the employer contributing about 80% of the total plan costs. With this change, the employer contribution will still be about the same as a percentage of total costs, but will be more closely tied to the employee rather than distributed across all Virginia Conference churches.
In early 2024, the Treasurer's Office, the Center for Clergy Excellence, and VAUMC convened a task force with members representing leadership from a variety of conference entities, including VAUMC, the Council on Finance and Administration, the Board of Ordained Ministry, and the Bishop's Cabinet. This task force discussed the potential replacement of the apportionment with a direct bill structure. Following thorough consideration, the task force recommended the adoption of the direct bill approach to active clergy health plan funding beginning in 2026. Specifically, the recommendation is to bill churches a flat per health plan eligible clergy person each month, regardless of whether the clergy person elects individual or family coverage or elects not to enroll in the plan at all. This approach will ensure that healthcare plan coverage elections do not impact the appointment process.
From VAUMC's perspective, one of the most significant impacts of this change will involve the rate at which the employer's share of the health plan cost is paid. Over the past decade or so, VAUMC has received about 85% of the health plan apportionment each year. With no margin built in for uncollected apportionments, the shortfall in apportionments has been made up through VAUMC's operating budget or through reserves. Under a direct bill structure, a payment rate closer to 100% is expected. The improved payment rate will help to mitigate required increases in VAUMC's other apportionment, which helps fund the retired clergy health program. As overall costs in the health plan for retired clergy increase, the corresponding increases in the retiree health plan apportionment may be more moderate.
We have analyzed the church-level impact of this change and have found that while some churches will see higher health plan-related costs, a majority of Virginia Conference churches will see a decrease in costs. While it is too early to precisely project total costs in 2026, our office has prepared a calculation tool that can be accessed on our website at the link below to estimate the projected impact of this change at the church level. That tool is based on actual 2025 health plan costs and assumes that the increased rate of payments from the direct bill approach will offset some of the retiree health plan costs that would otherwise need to be included in the retired clergy health plan apportionment.
Going forward, VAUMC's processes will be largely unchanged. We will work with our external actuarial consultants each year to calculate the total projected employer funding that is needed for the conference-sponsored health plans. We will communicate the total funding need to the conference treasurer's office, and that office will identify the amount that will then be billed for each health plan eligible clergy person. As always, VAUMC will evaluate plan design and participant contribution strategies that will help to mitigate the financial impact of the health plans on conference churches, while ensuring that our full-time clergy are offered adequate and affordable health care coverage.
Local church leadership who have questions should first use the calculation tool available at www.vaumc.org/direct bill to assess what this change will mean for their own church. Any further questions may be directed to your district superintendent.